Demo 7-1. Main cartilages of the larynx is this C-shaped thyroid cartilage seen here. You have the ring-shaped cricoid cartilage seen here, and then you have the epiglottic cartilage seen here. The paired cartilages consist of the arytenoids on either side here, the corniculate cartilages seen at the apex of the arytenoids, and then not pictured, we also have a set of cuneiform cartilages. The thyroid cartilage, it articulates with the lateral surface of the cricoid cartilage seen here. It attaches with these cricothyroid joints on either side. The cricoid cartilage also attaches to this first ring of the trachea seen here. The epiglottic cartilage, it attaches to the hyoid bone via the hyoepiglottic ligament, and then the stalk of the epiglottic cartilage attaches to the thyroid bone via this thyroepiglottic ligament. The arytenoid cartilages, they articulate with the lateral parts of the superior border of the cricoid cartilage. They are attached via these cricoarytenoid joints on either side. Your vocal process, which is the anterior portion of the base of the arytenoids, it's attached to the thyroid cartilage via this vocal ligament. Your vocal cords, there's a vestibular pair, which are your false cords seen here. They're protective in nature, and they are two thick folds of mucous membrane. They enclose the vestibular ligaments. Your true cords, which are your vocal folds, seen here, inferior set, they are responsible for phonation, air movement, and they're also a main inspiratory sphincter of the larynx when it's closed. The regions of the laryngeal cavity are the vestibule, seen here. You have a middle portion that is the central cavity between the vestibular folds and the vocal folds. You have a ventricle that is the area between the vestibular and the vocal folds that extend laterally. And on this lateral side, you have the saccules that contain mucus glands for secretion. And then finally, we have an infraglottic cavity seen here that lies between the vocal folds and the inferior border of the cricoid cartilage. And this area is also continuous with the lumen of the trachea.